Good evening, everyone. Is the audio and the video clear? Is the audio and video clear? Great. So, now this question here, what should be the answer for this? The main purpose of covering the retromolar pad area is. You can just mention A, B, C, or D. Perfect. So a lot of you have doubts based on this. Retention is the main purpose. If they talk about the different purposes, stability is also one of the purpose. But if the question has specifically asked you about the main purpose, the answer is going to be retention always, right? So do not get confused in this. The retromolar pad will help in getting the peripheral seal in that area, and that peripheral seal is important for retention, right? So stability is obviously there as a secondary factor, but the primary is retention, right? Now, I have discussed this question earlier also, but still I feel a lot of you have doubts on this. What should be the answer to this question? What should be the answer to this question? Great, absolutely right. See, in the textbook of your MCQ book, which is Pulse, the answer is mentioned wrongly. Please note that down on your Pulse itself. The final impression or the primary impression, whether it is for a complete denture, an FPD, implant, RPD, whatever procedure is being done, the final impression will always be seated posteriorly, right? There is no point in placing it anteriorly because all the excess material is going to flow down to the throat. So we always put it in posteriorly, and then you can see the frenum and orient the impression tray anteriorly into the exact center, right? So that is why it is always placed first posteriorly. Yeah, so what about the answer to this question? Great. So if we go exactly by the term, I mentioned earlier also when I was taking your live classes that, sometimes these questions, they are all based on memories. So they're all based on memories of students who have appeared in the exam. There are quite a lot of chances that they would have forgot a couple of words which were there in the options there, and they just remembered the main points. So here the answer is definitely going to be palate. It's not alveolar ridge. Secondly, if the question is asking clearly on which part of palate is primary stress bearing area, the answer which you have mentioned is absolutely right, and that is the posterolateral slope of the hard palate, right? Anterolateral slope is not the primary area. The rugae area is a secondary area, right? It is not the primary area. So posterolateral slope is the primary area. I already mentioned that this is, why is it a primary area? Because the forces fall at 90 degrees, right? They are falling perpendicular. What should be the answer of this question? I get a lot of doubts. I don't know why, but let me make this clear to you today as to how this appearance matters. So, dull appearance of a mouth temperature wax indicates what? See, that is why I was talking about here in this question. So, if you carefully analyze this question, insufficient material is also correct. Contact of material with tissues is not correct. Why is this not correct? Because when they are specifically mentioning contact of the material, this means that it is talking about full contact of the material. They are talking about complete contact of the material, which in this case is going to be wrong, right? So partial contact is also correct. Insufficient material is also correct. Now what you need to understand, that when we are talking about dull appearance of wax, it means that it is not in contact with the tissues, not in contact with the tissues. If we are talking about glossy appearance of wax, glossy appearance means it is in contact with the tissues. When they are talking about dull appearance of green stick, if they are talking about dull appearance of green stick, it means there is contact. And when they are talking about a glossy appearance of green stick, this basically means that it is not in contact. So what happens with green stick is exactly opposite of what happens with the flowable waxes, the waxes which flow at mouth temperature. Is this concept absolutely clear? Take down these 4 points and type in the chat box clear for me to see whether all these things are absolutely clear to you or not. Do not get confused. See what the question is asking, whether they are asking about a mouth temperature wax or they are talking about a green stick border molding. Great. What about this question? Gothic arch tracer. Gothic arch tracer. Absolutely right. It is for centric relation. Now, this Gothic arch tracer is used for CD, is used for FPD, or is used for RPD. Where is it used? CD, FPD, or RPD? Absolutely correct. So these Gothic arch tracers are used for complete denture centric relation only. What about this question? I regularly get doubts from you regarding this question. PPS anatomically is. This is again from your dental pulse. See, all of you are answering this question, but let me tell you at the outset that this question is wrongly framed. This question is wrongly framed. The question itself is incomplete, right? Why is this question incomplete? Because you know that PPS, if you divide it into two parts, it is one part is the pterygomaxillary seal and the other part is the post palatal seal, right? Where you know that the hamular notches are important part of PPS anatomically, right? So this question will make sense to you only if this posterior nasal spine is changed to post palatal seal. Only then this is going to be your answer, right? All other options are obviously not the answer. Now, if the question comes in your exam in the exactly same format, the answer is going to be number 2, but most likely it is not going to come in this format. They want to make it very clear because this used to happen earlier. Now the computer is going to select all questions for you, so they are going to check out the questions and only then put it up there. So it's not that one person is making this question paper and it falls into your sheet, right? What would be the answer to this? Very, very common question during recording of the PPS. What happens? Very, very commonly asked question. Good. So the answer here is soft palate only. Do not get intimidated by addition of pharynx because nothing is changing in the pharyngeal muscles when the PPS is being recorded. The face is being tilted down. Option 3 is also correct. Option 3 is also correct. But always when you get MCQs, the only instruction given is choose the best answer. Choose the best answer, right? So the best answer here is to activate the muscles of soft palate. Why? Because when you are recording the PPS, the patient is going to bend to 30 degrees. That is the maximum bending which will happen physiologically, right? Even when the patient is eating, you can see, we do not always sit upright and eat. We bow the head down, right? But you never eat with your head up, right? That is the reason, why we started recording PPS with the face being tilted down and not keeping it straight, because the moment patients used to eat food, they used to bend their head and the denture started falling, right? If they were sitting straight and eating, the denture was there retentive. There is where we thought about it. The prosthodontists of that time, they thought about it and they started tilting the face downwards because they realized that the muscles of soft palate will move, and that movement we can record while doing your border molding and final impressions, right? What about this question? beak shaped tracing is seen in which plane? Very good. So, beak shaped tracing, other than the sagittal plane, is also there when you talk about the envelope of motion. Envelope of motion also looks like beak shaped. So in your question, they will never put both these options. It will be in sagittal plane, and the other one is the envelope of motion. If you see the complete envelope of motion, that also looks like a beak shaped. What is the shape in the horizontal plane? What is the shape in the horizontal plane? This horizontal plane is divided into two. One for dentulous patients and for edentulous patients. Dentulous patient, it is diamond shaped. It is diamond shaped. And what is the shape for edentulous patients? It is arrow shaped tracing. Arrow shaped tracing. What is there in the frontal plane? That is called as shield tracing. This is called as shield tracing, right? Horizontal plane for dentulous is diamond, for edentulous is arrow, and frontal plane is shield shaped tracing, right? All this part is clear to you. Very simple, straightforward questions where you need to know which kind of movement will occur in which kind of tracing. What would be the answer to this question? Fissure angle is seen in which plane? Which plane do you see the fissure angle? Absolutely right. It is sagittal plane. And which plane do you see the Bennett angle? Bennett angle is in which plane? Bennett angle is in which plane? Bennett angle is in which plane? Yes, absolutely right. Bennett angle is in horizontal plane. So next question is related to Bennett angle. Which kind of movement very good. It is lateral movement. And what is the angle? L is equal to H by 8 plus 12. So L here stands for Bennett angle, right? What does H stand for? What does this H stand for? In the Bennett angle, what is H? What does H stand for? Yes, H stands for horizontal condylar guidance. H stands for horizontal condylar guidance. So once you measure the horizontal condylar guidance for a patient, you can easily measure the Bennett angle, right? It is not intercondylar distance, it is the horizontal condylar guidance. On an average, this is 30 to 35 degrees. That is the value of H. 30 to 35 degrees is the value of H on an average, but it differs from patient to patient. Yeah. Now this question, what is the device which you see in this image? What is the device which you see? Ishafjot, I told you it is in the lateral movement of the condyle where this angle can be seen, right? Not in the medial movement. So what you have identified is a Gothic arch tracer, absolutely right. What is the purpose of this device? What is the purpose of this device? We just talked about it. It is utilized in recording centric relation. Now my question to you is, the device which you see here is an extraoral device or an intraoral tracer? Is it extraoral tracer, what you see here in the image, or an intraoral tracer? A few of you are writing intraoral. It is not an intraoral tracer. It is an extraoral tracer, right? The tracer lies outside the patient's mouth. What do you see in this diagram? What kind of an articulator is this? Can you identify the articulator? See, what you see in this image is that there is a tracer which is attached. There is a tracer which is attached. And these tracers can only be attached in a semi-adjustable articulator. These tracers can only be attached in a semi-adjustable articulator. A few of you have written mean value. Now, if you remember when you were making complete dentures in your colleges, did you utilize something like this as a tracer to put it on the articulator? No. Why? Because a mean value articulator will not accept these records, right? Other thing here is the mandibular part. When you see, let me change the color. Yeah. The mandibular part is totally joined with the frame. The mandibular part is totally joined with the frame, which means the maxillary is mobile. The maxillary part will move, which directly indicates that this articulator will be a non-Archon articulator. It is not an Archon articulator, it will be a non-Archon articulator, right? And a few of you have identified it absolutely correctly. This is Hanau 96H2 articulator. Hanau 96H2. So whenever they give you an image like this, they will not be asking you whether it is Hanau 96 or University series, but what they are going to ask you is whether this is an Archon or a non-Archon articulator, and whether this is a semi-adjustable articulator or not. So I have given you that answer. This is one of the most commonly used articulator in prosthodontics, right? One of the most commonly used articulator is Hanau 96H2. Yeah. What would be the answer to this question? I'm sorry, the figure is a little hazy, but I hope you can understand it because you would have seen this question a couple of times earlier as well. Ishavjot, when you see an articulator, to understand whether this is a semi-adjustable or not, you just have to focus on the top part of it. So you have knobs here. These knobs will help you in adjusting the condylar guidance, right? Yeah. So Bennett movement, which side it is going to move, working side articulator, working side condyle is going to move in which direction, non-working is going to move in which direction. Okay, so since there is a confusion here, see, my question to you is, you just don't see the question here. Leave whatever the question is talking to you about. Just tell me that if you are moving on the right side, if the mandible is moving on the right side, where will the working condyle move? Laterally or medially? Try doing it yourself. That is what I told you during the live classes as well. Try doing it yourself. Try moving your mandible to the right side and then tell me where your right condyle is going, lateral or medial. So फिर why are you putting up answer as B? So all of you are okay in telling me that the working side condyle will move laterally. Then why are you giving me the answer as B here? Because the non-working side is always going to move medially. Whether you are moving on the right or the left, the non-working side is always going to move medially. It is the working side which is going to move laterally. It is so very simple, right? So do not get confused. Go on to your basics, understand your basics. You don't even need to see the question in this kind of an MCQ. They have given a straightforward statement, and that statement you have to look into. Do not confuse yourself thinking that so the examiner is asking you something which is very twisted and it cannot be straightforward. There will be straightforward questions in the exams in all the subjects, right? So look out for those straightforward questions and appear, give an answer for them right away. They should be your first go-to questions, which are direct, straightforward questions. Right. So what is this equipment which you see here? Can you identify? Yes, Sutirtha, you are right. Bodily movement is measured by non-working side, but beta wo पूछ नहीं रहे हैं ना. They are not asking you that question. It is good that you have this information, but they are not asking you this question. What they have asked you very clearly is what is moving where. So agar non-working medial hota, that would be your answer. Great. So all of you can identify this diagram. Who gave this device? Who gave this device? Who gave this device? Jon Snow, absolutely. And what are the different types of this device? Different types of this device: arbitrary and kinematic. Arbitrary commonly used for complete dentures. Kinematic is commonly used for fixed partial denture or something called as full mouth rehabilitation. Right? Arbitrary is used for complete denture, and FPD and FMR, full mouth rehab, you use kinematic. So whenever you have to change the vertical dimension, now unfortunately in Pulse, this question falls in complete denture chapter, but it is a fixed partial denture question. If they are talking about the kinematic phase bow is used to change the vertical dimension, and vertical dimension is changed when you are doing a full mouth rehab, not in the complete denture. Why? In complete denture, you are establishing the vertical dimension. You are not changing it. You are not increasing or decreasing it. उसमें तो vertical dimension है ही नहीं, right? So you have to establish the vertical dimension in a complete denture. Where you have to change the vertical dimension, that is a full mouth rehab case, right? Yeah. What is the answer to this question? Arey bhai, so I have 1, 3 and 4 all coming up as options, right? Okay, so when you are making a complete denture, first you tell me, people who have marked 1 as the answer, can you see the Frankfurt horizontal plane externally? Can you mark the Frankfurt horizontal plane externally on the patient's face? No. For Frankfurt horizontal, ये सब काट के you will have to go to the bone, right? So when making a complete denture, the occlusal plane has to be parallel to these two, the Camper's plane and the interpupillary line. What is the difference between the ala tragus line and Camper's line? What is the difference between ala tragus line and Camper's line? What is the difference? The difference lies in the part of tragus where that line comes in. Ala is there, which is situated in the position. But for tragus, which part of tragus is going to come up when you are dealing with Camper's line? Right? So always the Camper's line will be from the superior part of tragus. Superior part of tragus, right? Do not forget this. if they have given you a fifth option which says ala tragus line, this will be the incorrect answer. This will not be the correct answer. So Camper's plane and interpupillary line. So they are going to give you a complete plane. Idhar se for the posterior you have from alar to the superior border of tragus. For anterior you have the interpupillary line, right? What would be the answer to this question? Yeah. Great. So all of you are correct here. Last question for the day. Window impression technique is used in the following case. Very good. Absolutely right. Flabby ridges are where window technique is used. And what is the material of choice? What is the material of choice for flabby ridges? What is the material of choice for flabby ridges? Yeah, you are right. It has to be mucostatic. But what is the best material? See, a few of you have written POP. POP is wrong. The answer is impression plaster. The answer here is impression plaster, right? That is the material of choice, right? Impression plaster. Yes, Shreyashi, you are right. If it is not impression plaster, then alginate. Absolutely right. So the first choice or material of choice will be impression plaster, right? For knife edge ridge also it is a mucostatic technique, but we do not use a window impression technique for knife edge ridges, right? It is a mucostatic because you want to record the entire ridge. In flabby ridge, this mucostatic is used to record the flabby part of the ridge and not the entire ridge, right? Ayushi, ala tragus line means it is from any part of tragus to ala. Camper's line means it is from the superior border of tragus to ala, right? That's good for all of you, and it is good to see you again. And I will be coming back within 2 to 3 days with another set of quiz, and the next one is going to be quite tough since this was the first quiz. I have taken out more questions from the areas which you already consider reading. The next one is going to be a tough one, so be prepared for it, right? Yes, Akshar, don't worry. I am coming out with a video on all the doubts. But in the meanwhile, I would, seriously request you to go ahead with the videos which are already there on the doubts, right? Most of your doubts are solved in those videos. Whatever is left is going to be there by the end of 5 to 7 days for sure. Don't worry. Let me know what topic you want for the next, you can just put up and tell me in the group whatever topic you guys want for taking up during the quiz. And or I'll ask Dr. Ahmed to put up a topic there, right? What is cutting? I have not understood. Review cutting means what? Okay, I'll take up a topic from RPD, that is for sure, don't worry. Cutting tooth for ceramic. Okay. We'll take that up also later. So, whenever we are meeting next, I will be taking up a topic from RPD, and I will make sure that that I grill you well while dealing with RPD, right? See you soon, guys. All the best. Good night.